Hello everyone, my name is Ruta, I'm from Near East University, and today we are having the new session of Let's Be Connected. Today we're gonna provide you some information regarding the Faculty of Medicine, and in order to do so, let me introduce you our today's guest, Professor Dr. Finn Rasmussen, the head of Department of Allergy, Sleep and Respiratory Medicine, as well as the respected doctor at our Near East University Hospital, who has worked in various hospitals in Denmark, in Canada, in Norway. So welcome. Thank you for joining us today.
Thank you very much. Pleased to be here.
How are you today?
I'm good. I'm good. Summer is coming. Everything is good. People are happy. We are outside, protected from Corona. So everything is good.
We would like to thank you for joining us today and being today's guest. Medicine at our university is the program in great demand, and as the results that we have in also the hospital, highly equipped with new technologies, and it's also a very big advantage that it's located on campus, Near East University campus. So the students not only study at the Faculty of Medicine, but they have the direct contact with patients, real patients. So we are very excited, and shall we go through some mainly asked questions by our prospective students, if you are okay with it?
I'm okay, whatever you want to hear, and I will answer the best of my abilities.
Thank you so much. At the beginning, we would like to ask you, if you don't mind, to briefly introduce yourself to our viewers.
Yes. As I was born in Denmark, got my primary education there and also my medical education as a young student and a doctor. Then afterwards, I was looking around the world, where could I get the best education. And at that time, I went to Canada and did some of my PhD in Denmark. And there, I get my specialty at university hospitals in Denmark, and went to Norway and again Canada to work. And due to life's interesting circumstances, in 2010, I moved to Cyprus, and I've been here since.
It's nice to have you here. So as we understand, you have a very bright experience.
I can tell about my education. In the education is I mean, different places in the world, you have different ways to get to your goal of a specialty. For example, within medicine, there's slight difference, different places. And it's not always the matter of how the system it is. The matter is how you approach it, how you study it, how you address it. So it doesn't necessarily mean that you need to be worried that the educations are different from different countries. If you go to the specialty and get it, some places, often if you are hardworking and bright, which most of us are, then it will go fine. For example, in Denmark, you do first your internal medicine, then you do your respiratory medicine, and then you can sub-specialize, which I did in allergy, and also sub-specialized in what is it called, sleep. But I also work with transplantations, but there's no subspecialty there. But you know, it's an area of excellence for me there. So I'm just telling that the different way you can approach later on, even if you choose a connection or study to do here, if it doesn't resemble totally your own home country, it doesn't matter so much, because you can still adapt to it and you can still get your specialities as you wish later on. So that's my point.
Yes, thank you. That's excellent point. We are very happy to have you here, especially as you present yourself that you have a broad experience internationally. You work not only in your home country, not only in one country. You have traveled and you got the international experience.
Yeah, thank you very much for your kind words. What I would say is important here, my lesson learned is that people are people, patients are patients, and we are all have the same desires. We all have the same worries. We all have the same wishes for ourselves, for our partners, for our kids. And that also reflects how you have to look at it in disease, because even though there's cultural differences, if you kind of peel off that cultural layer, you can actually identify, regardless where you are in the world, all the diseases, because of course there's prevalences that are different between different places of the world, but the disease generally evokes the same worries, evokes the same needs for treatment and diagnosis, regardless where you are.
Yes, it is. Thank you so much for such a good points. Speaking about the faculty and medicine and the programs that students gonna study, the prospective students who gonna apply to our university, may you represent in general what does the program covers, duration, subjects that the students gonna learn?
What I see from here, that I now you have to take the reservation. I have been here for 10 years, and I know what is happening in other places. I talk to my previous colleagues and now friends, and of course we sometimes address it. But what I can see in general terms here is that if I should point out the good part of it, is that and it meant in every kind of way, you work hard in the start and you do your all your theoretically part. You also see patients, but then in the end of this medical round here, you have a lot of clinics, and there you can reflect over what you actually want as a specialty when you're finished. And I think that reflection and that possibility, if you use it right, is a golden opportunity, because when I was finished, we did it opposite. In reality, the last year you had a lot of studying theoretically before your and you didn't have time to reflect of what you actually wanted, that you had to use a lot of time during your working as a doctor in the start. But here you actually have that time to reflect what you want. Of course, you have to reflect, you have to think about it, but here you have the opportunity. And I think that's one of the strengths of the medical studies here. Of course, it takes that people has to be a little bit workative. They have to keep their knowledge update. But in reality, we all have to do that, and it has to be a common thing that people get to used to, that they keep update all the time. Their education never stops.
Yes, it is. Also, as much as we know that the medicine department, differently than the other departments, are not going through semester terms like studying, for example, 5-6 subjects per semester, they study modules, so-called committees in here. Would you please explain a little bit about it to our students?
Yeah, what they do is, I think these modules are interesting in the part that they are addressing different diseases at the same time, like they're trying to address thorax diseases at one model, and then you're repeating that in the internal medicine model another time. As in all things, there's advantages and disadvantages. The advantage is that you kind of get a whole view on it. The disadvantage is that these semesters, I think that the students think that they are working a lot. To be honest, this is what they actually should get used to. And actually what they don't know at that time is that they have the time to reflection later on. So yeah, they have a little bit compressed learning there, but most of them actually managed very well, in my opinion. And they also learn to prioritize their knowledge, because they cannot learn everything at that time what is of knowledge in the world, but they have to manage to prioritize what is important as a ground level of knowledge to prioritize, so they have the necessary tools to continue as a good doctor, but of course also as a medical student, let's face it, to pass the exams.
Exactly. Yes. So would I be correct if I would say that students are not going through one term, let's say 5 months or 4 months, they are taking each course at once, right? So one course at the time, right?
And that's quite common everywhere in the world. They do these courses. Of course, the contents is different from different places, and there you concentrate on one thing and then you finish it. And I think it has some advantages and disadvantages, but I think this is the way to do it now, to kind of focus on one thing, because that is what you have to do later on anyway. So it's always a balance of when you look at the whole education, is there enough time? Is there enough, if there's enough hours for this? And of course, when we are finished, we always think that our specialty is the most important in the world, because we choose it and we are happy with it. But it's also a good thing for our teachers, including me, to kind of prioritize and say, what do you actually need to know as a basic doctor when you come out about this subject? So I think it is a good approach, it is an okay approach to a different prioritization of what is important when you are going to be a medical doctor.
Yes, thank you for such a good explanation. Speaking about, as I mentioned before, and we together mentioned, that we already have the hospital itself on the campus, Near East University Hospital. What are their opportunities for the student to broaden their understanding if they need some extra knowledge in, or even just to strengthen their knowledge in terms of hospital, maybe laboratories?
I mean, I don't think there's any limitation of an active student to do. Basically, you here can do whatever you want. I mean, you can, if you feel that it's studying books is what I need at the time being to kind of improve my general knowledge, there's possibilities and libraries for that. And if you need some more practical things, in reality, I say to all my students, you can come to the office, you can come to the lab, whatever you want. I think that at that time, many are very busy and they read, so they don't feel they have the time, but they have the opportunity to do it. And I do understand that it's busy times and they have to study hard. But the thing is, they have the opportunity to do it. And if they have the necessary energy and the necessary extra time, it's open. I don't think any of us would ever say, no, you can't come. they can participate whatever they do. And I know some students in the past, for example, said, I would like to spend my summer vacation in following you. And I'm impressed. I'm happy. I'm thinking, wow, that's good. She or he is going to be a good doctor because they really put the energy for it. And that is, of course, nice. You don't need to do that, but you have the possibility to do it.
Okay. What about the training programs? Maybe some of the departments has summer training programs as mandatory course. What about the medicine? Does the student needs training programs, like summer training programs? Is it mandatory, or it's already part of the course to do the practice in some years?
In reality, we show the way, and then they have to do it themselves to the patients. And at least what I do is I say to them, practice on yourself first, or your family, and then practice on patient. And then if you want, you can come and show what your ability is. But really, it's, I mean, my opinion is, and also this, it is, what do you have the opportunity to do it or not? And I mean, in reality, you only need one patient. You only need one patient to do. You don't need many patients. You need one patient to look thoroughly at all of it, to try to put plans, to try to put investigations. So you have, if you do that, and you do it one time, even every day or every week, it's enough, because you just need to know what you're doing and discriminate between disease and non-disease, for example. That's what I'm saying. And discriminate between very ill, needs to stay at the hospital, or not so ill and need to go home. And if you have these abilities, then when you're finished, you will learn it. But yes, as a student, they can do, and they have been doing it. I would like to see more doing it, but during their education, in principle, if they are observant and they are listening and they are doing their practices, they will get enough to be able to do the basics. But of course, the more you practice, the better you get. And it also counts for us. The more we read, the more we practice, the more we do, the better we get. It's not only skill, it's also hard work.
Exactly. Yes, it's exactly the way you said. Thank you for such a good explanation. Speaking about the medicine in general, the students at the end, or maybe after graduation, when they're choosing their graduate studies, they're choosing the specialization. So can you a little bit explain when and how do the students choose their specialization?
I mean, as I see it, I mean, there's often two kinds. Of course, that is a very, very generalization of it. Often people comes in and they know what they want to do, or they decide through medical school. Then there's the second one, where it happens a little bit by chance, by where they feel well. The blessing of a medical education is that you can work everywhere in the world. Look at me. And you can do okay, you can do well. And you can actually do basically everything within creating your own firm, working publicly, working privately. You can do management, you can do lab, you can do clinical, you can do operations. So I think already there's a lot of opportunities. And here, of course, if you have postgraduate wishes, especially PhDs, that will improve your abilities to get a job, and a good job everywhere, these opportunities are here. Basically, in the cooperation with the staff, like the doctors or the professors, you can find a subject that suits to you and try to, for example, start up with a PhD and hopefully do well on that. There's no doubt that if you find a good study and together with your supervisor, your doors are open to go everywhere in the world, because that is what they look at later on in life. It's not so much that you are a doctor. It's actually, what did you do as a doctor? Did you show that you can do something special? Did you publish something? That is important when you're finished.
Yes, it is very important. Also, as you mentioned about postgraduate studies, that they are specializing themselves. What are the advantages? Maybe you can present more about advantages, and also, do our graduate students continue the studies at our university?
Yeah, I mean, they can continue if they do some postgraduate. They can continue as teachers here, and of course there is these possibilities. It really depends on the openness. The world is open for you. The world is our oyster, whatever we say. And I know people who came from other countries and did very well here because they are smart, they are skillful, and they do good studies. So of course, it's really, in such a situation, it's really down to the person, and of course that you find a supervisor that you trust, that you work well together with. Then basically you can go everywhere in the world, including here, and continue your career. That is what I would say. Do you have any? I mean, I don't know exactly what you meant when.
Well, it's okay. It's okay. Also, as you mentioned about the working in every country, so what about job opportunities? As you mentioned, that they can work in every country, they can work as the doctors as well. Is there any other options?
When you're a doctor, of course there is. I don't know exactly how it is when you are some countries, according to where you get educated, you need to do further exams, and that's the same from everywhere. You cannot necessarily do a direct transfer. That you have as a student to look into. But generally speaking, if you are studying hard during your medical education, I mean, the questions are maybe just in another language, but they are the same. So you should be able to do that. I'm not saying it's easy, but as you may remember in the start, I said the reflection period here, where you kind of go from different departments what you want to do, you should not use them not to study. You should use them to kind of keep your information updated and so on. So, and if you do that, then your abilities to kind of move on, if you don't want to stay in Northern Cyprus, for example, here, then they are very well. They're good. But again, I must stress out, it's about your own work ethics. It's very important that you work hard, and then afterwards, yes, I'm not against relaxing hard, but the main focus is on that. And if you could do that, you can stay here, do your postgraduate, you can come here, do your postgraduate, you can go another place, do your postgraduate. What people want is that they can see people are dedicated to their education and to their job, and to get the job done.
Yes, I believe dedication in medicine, studies for medicine, it's one of the most important parts, to be dedicated for people, to treat them, to cure them.
Now I'll tease you. I didn't know that I wanted to be a doctor. I just chose to see how it was.
Wow.
But what I did is, when I went into it, I went 100% into it and see, okay, if you choose something to see how it is, you should not go 20% in. You should go 100% in, and then decide, is it something for me? I'm not saying you exactly know, for example, if you go in as a medical student, that you're going to do exactly what specialty or what you want to be a doctor even. But if you go in, you should give it a chance, and you should work 100% for it. That would be my point. That you are dedicated and you want to save the world. That is perfect, but you have to save every patient you see one by one. That is the main thing. It's like a football game. Only the next games matters. So every single patient, for example, is important. You can't just leave one out. That is the dedication that you have to put to your studying also. Every subject is important until you choose. Maybe it can be gastro surgery. Then, of course, that is the most important part.
Yes, it is. And as we see, when you didn't think about medicine, it's very nice, as we see that your life went through, and you did your PhD, even you continue your studies, and now we are having you here.
Thank
as
you.
the doctor, as the professor. Thank you so much. Also, our students asking so much about accreditation of the program. Maybe you can share with us some information about accreditation, about membership.
I really don't know a lot about that. Unfortunately, I'm not in the inner course of that. But what I think is that even if there's a lack of accreditation somewhere in the world, if you do your studies and you do your education, even if you have to take your final exam one more time another place, if you follow the lessons here and you do study hard, then it should be relatively easy to do it, because it is the same principle everywhere. And we are following the same principle. That's why I'm saying, and so I cannot 100% address that issue, unfortunately, because I don't know. But I know that if you have to do it some places, and even for me, if I went some places I need to work, I needed to do an extra exam. It's very few places where I came from, but I still had to do it. But if you study hard and you are prepared, it is possible regardless where it is. And if you know if there is such a problem, I know they're working on it here. I don't know how far they are. I heard about there were some problems, but I also heard that if it could be overcome by doing some exams there. And in principle, it's just a repeat thing of, did you actually understand this? But the details, unfortunately, I don't know. But I know somewhere you can get direct transferred. Other places you need to do an exam.
That's fine. Thank you for sharing this information. I believe the students who would like to know this information can always contact, I will just say shortly, International Student Office, so they will provide this information for them. Continue about current situation, not only in North Cyprus, in the whole world, more specific about COVID-19 situation, which just appeared with no announcement to anyone. And you, as the professor, also as the lecturer at the medicine faculty, may you give us some information? How did it go with classes? How did the online classes went through? How did medicine faculty could deal with the situation that we don't have direct contact in classes with the students? We needed to put everything to the online system. So may you present a little bit information about it?
I think the university handled it quite well. I'm not a big fan of education at the net, I'm sorry to say. Why? Because I like to have an interaction between people. I like that, and I think it will come back. I don't think it will come back before next year, I think, but we will see. Nobody knows about the Corona time. Until then, we just have to deal with it, like we have to deal with any obstacle there is in our life. I think they put, I mean, it's not easy to do it because even us talking here, there's a lot of distraction. In principle, people could go just in front of the computer and you cannot see, or for example, when you are looking at the screen, it's like looking television or your own smartphone, it's easy to get distracted. So, but again, if it's if people are interested into learning, of course there is a possibility. So we have challenges. I think the university is trying very well, and I think they're doing better than many. Personally, if I should look at my performance, I'm not one of the best, definitely, because I like the interaction. I like to make people to think in the interaction of what we are talking, and I miss that. I miss the human interaction doing these issues. So so I hope personally that it will go back to normal, and I think it will do that not this year but next year.
Okay. What about examination? How did the medicine faculty held the examination through this? Because there is no interaction, like physical interaction. Everything was done online.
Yes. Well, I mean, I think they did as good as they can in reality, and I think they tried to address it quite progressively and try to make the best out of the situation. Because let's face it, none of us knew anything just before February. Yes, maybe the Chinese knew something. To make a joke
Maybe.
here, but, yeah, so some seems that they did, but okay, they wanted to be sure, or they wanted to buy some mask for themselves, who knows. But now we have a situation, and all universities in the world had to deal with it, and all schools had to deal with it. And actually, if you look around, I think Near East did quite well in comparison to many other places also. And I'm not talking about I'm talking about the world. I mean, they did quite okay. Is there obstacles? Is there challenges? Definitely. Some of us are definitely missing the interaction, and because in reality, in my opinion, it's much easier to read body language, face expressions when you talk, when you have it in 3D than compared to 2D. I mean, it just gives the extra notch to it. But said that, I think Near East is doing well, even compared to the world.
Yes, exactly. The students, some of the students much better take the information with a live interaction, and I believe it put some obstacles and exactly had some disadvantages in learning. But of course, from the situation that we could do, I believe, as you said, the Near East University did the best as they could with the situation that is around us.
I think so. Really, I think that is the take-home message here. It's not ideal. It's never going to be, but you have to get the best out of it. And I think our institution did quite well there. I must say. Did many teachers suffer from it? I think so, because of course things were not in place in the start. Is there still challenges? Definitely. But hopefully, slowly, the small diseases of childhood zooming, or whatever it's called, will slowly get better.
Yes, I believe that one of the main, as we call it, bread life vehicle for the professors, for lecturers, is that physical interaction with the students. And last semester, and most probably upcoming semester, that's what the unfortunately professors will not have, even though we are doing classes online. Hopefully we will go back to normal and to our regular classes as soon as possible.
I hope the students also miss it. I miss it. We have to ask them, but I think it gives. But I mean, now we can't talk about old days because they were always worse or better. We have to deal with the situation now. But I think that when most of us old people got the corona, then because due to age, it's not that problematic when you're younger, then we can hopefully do the normal classroom teaching again.
Hopefully. Thank you so much for such a great explanation, such a cheerful chat conversation. For the end, we would like to ask you to share your advices for the prospective students who is thinking to study medicine, or also for our current students who, because of this situation, lost direct contact with you, with other professors. May you give some advices for them?
In reality, now now on the note of going out here, I really don't think that the students I met here were quite determined on what they wanted. They were many frustration. You mentioned some of them of the accreditations that hopefully will be solved. But generally speaking, my belief in the young generation is, or the new medical doctors coming, is quite high. I'm sure if they are willing to come into the medical study, and in reality, I'm not talking only about medical doctors, because it's regardless what you're doing, you should be humble. You should be hardworking, and you should work for the people that you are serving. That doesn't mean that you shouldn't wish for good things for yourself, but often if you do the good things for others, good things comes to yourself, in my opinion.
Thank you for such a perfect advices and tips. Thank you for joining us today. It was my great honor and all university great honor to have you today as our guest professor. If you have something to say for the end, we are just giving you time now, so feel free.
Keep your parents safe and grandparents.
Thank you so much, Professor.
You're welcome. Bye-bye.
See you. Bye-bye. Thank you for all of our viewers as well. Thank you for watching this video. Feel free to contact us directly through our WhatsApp, social media as Facebook, Instagram. Also, don't forget that we are having postgraduate admissions for scholarships. So you can also apply to the scholarships. Feel free to write directly, write us a message just now if you have some questions. And don't forget that we are having the new session, which is tomorrow, regarding the Department of Pharmacy. It's gonna be great because we're gonna have two guests, which is Professor Dr. İhsan Çaliş from as the Dean of the Faculty of Pharmacy, and also Professor Dr. Kemal Hüsnücan Başer, who is the director of the Institute of Health Sciences and also the head of Department of Pharmacognosy. So let's be connected. See you tomorrow at 12 o'clock. See you soon.